I wanted to talk more about how it is important to make sure that your mouth is healthy before we start Invisalign. And there are a lot of different factors here, but let's talk about a few. First of all, if you imagine when you wear aligners, your teeth are covered by a piece of plastic for the most part of the day, which restricts the amount of saliva that can get there. Saliva is what protects your teeth from cavities. It has antibacterial properties, it washes physically food and bacteria away from your teeth as well. So when you limit amount of saliva that gets to your teeth throughout the day, in a way you're compromising how much it protects it from cavities. Usually it's not enough to cause any real damage during the time of the treatment because you're able to remove the trays, clean your mouth. But if you eat and there is a food that's stuck under the liner sitting on your teeth literally for hours, then it's not a good environment, and it's not a healthy environment, and it can compromise tooth health. If on top of that you have some areas of cavities that you didn't take care of prior to starting Invisalign, of course it's going to just make things worse. The other part of it is dental hygiene. It is extremely important to have cleanings before, during, and sometimes even more often than you normally do with Invisalign treatment, because sometimes the hardened buildup literally blocks the amount of movement that we can do. Imagine if your lower teeth had to be aligned and you have to have space for that. Now, if this space is taken by this piece of calculus or hardened bacteria on your teeth, hardened food, of course, there is no way your teeth can be there because the space is already taken by something. And in some people, this happens more. In other people, it doesn't happen as much. Some patients would need those extra cleanings during the time of treatment for this purpose, for this reason. Inflammation is part of how teeth have been moved. Bone is being remodeled. As part of the inflammation, our gums can be bleeding more, which again is linked to bacteria that's sitting between the teeth. With inflammation, if bacteria is traveling through capillaries to the rest of your body, again, it's just one of those things that you don't want to create more problems. It is very, very important to have dental cleanings, maintain even more thorough oral hygiene during the time of treatment, and then definitely check with your dentist to make sure you're ready to start your aligners.